full name Pars Ramdanda. I'm 48.
Okay. And when were you first diagnosed with diabetes?
About 5 years ago, Christmas.
Okay. And did you have any symptoms that led up to being diagnosed?
Oh, I had all the classic symptoms. Wanted to go for a pee so many times a day, about 6 times a day. Thirsty all the time. Drinking gallons and gallons of Coke, which is my favourite drink, and all the symptoms.
And how did you then get diagnosed?
Quite by accident, actually. And I'm actually quite upset with myself being a pharmacist. I should know better. It was, as I said, Christmas time. My mother-in-law, who is a diabetic, she's a type 1 diabetic. She had come to visit for the Christmas holidays, and she said, "I've left my machine at home. Will you check my blood sugar levels, please?" So I checked them with my dad's machine, who's also a diabetic, and her figures came out to about 13.2, I think it was. And she said, "No, never. That's wrong. Absolute rubbish. The machine's lying." I said, "Tell you what, I'll do my sugar levels, just to show you there's nothing wrong with the machine." And mine were 26. So that's how I found out, with a big shock, that I was diabetic. Well, I went to see the doctor and took sugar levels and everything, and I'm definitely diabetic.
And how did you feel?
Annoyed with myself, actually, for not seeing the symptoms earlier. I stand here behind that counter, talk to patients all day long, and counsel them about the symptoms to look out for diabetes. Didn't see them in myself. Go and see a doctor and get yourself tested. The sooner you get yourself tested, the sooner that if your levels aren't that high, you can then just be diet controlled and exercise. It's the best thing. Well, I've quite necessarily had to give up everything sugary, which is a huge disadvantage for me, because I do have a bit of a sweet tooth, yeah, and I'm trying to look after myself a little bit more with what I eat and how I eat. Okay, trying to be a little bit more active, do a bit more exercise, try to get my weight down a bit. So standard sort of changes that anybody who's diabetic needs to make.
And how often do you have to go back and be checked? How often do you go to the doctor?
I usually go every 6 months or so. It's fairly stable, my diabetes.
So you've managed to get it right down now, so it's all...
Yeah, it's okay. Now my sugar levels usually are around about 7, 8, so which is within the norms for a diabetic. Well, nobody wants to have other members of the family who are diabetic, but obviously if people are diabetic in your family, it's good to have a chat and see how your conditions are, sort of compare notes, so to speak, and see what works for you, what works for other members of your family. Yeah. But if you're in the ideal position that there are no other diabetics in your family, then it's anywhere that you can get information about your condition, whether it be a pharmacist, your doctor, or if you go online and look at all the societies out there who cater for diabetics. The more informed you are of your condition, the better you can actually look after yourself. And it's a condition that obviously can't be cured at this moment in time, so it's a condition that has to be maintained. And the more you know about your condition, the easier it is for you to maintain your sugar levels at the right level.